Thank you everyone for attending the Brain Health Perspectives webinar, this one focusing on the built environment. We really are excited to be having Fiona Walsh with us today. I met Fiona in 2018. Can you believe it, Fiona? 6 years
Nope.
already. Exactly. Fiona really is an expert in her field. I think you potentially, I don't know if you are matched actually in terms of the expertise you have, in terms of the built environment, understanding cognitive load, and how to shift the built environment to support different people with different neurocognitive abilities, actually. Fiona is a qualified architect registered with the Royal Institute of British Architects and also Global Atlantic Fellow for Equity in Brain Health, based at Trinity College and UCSF in San Francisco. Over to you, Fiona.
Good afternoon, everybody. It's really nice to have you come to the presentation, and I'm hoping we can share a lively discussion at the end. We might pick up some shared interests here, and obviously every day for us is a learning day, so you will come with your thoughts and ideas and your experiences. So hopefully we'll all gain some knowledge today and move forward. I'm going to share a short presentation because I think the discussion is the interesting bit. But what it's trying to do is put in context how, coming from a design perspective as an architect, I need to understand the mechanism by which the built environment affects us on a day-to-day basis. And I think this is very much underestimated and in some cases misunderstood. But put together a very brief presentation, and hopefully you'll find it interesting and we can discuss the content following on from here. So Curti, I'll just go straight into it now if that's okay. So the topic today is the intersection of brain health and architecture. And what I would call this is inclusive design. And what we're setting out to do here is look at how our brain health is affected by architecture and how architecture affects us on a day-to-day basis. So disability. What does disability mean? Well, for the average architect, disability generally, they perceive it to be a physical impairment or a physical disability. And unfortunately, for people living in our society today, most of our guidance documents and reference documents also perceive disability to be purely physical. Now, if we look at the UN Convention for Rights for People with Disabilities, one of the conventions, Article 19, requires countries to eliminate obstacles and barriers to people with disabilities so that they can access their environment, transport, facilities and services. And I can tell you today that we're not actually honouring this with regards to people living with cognitive and sensory impairment. It also recognises the rights for people with disabilities to live independently and be included in community. Now, this is very, very difficult for somebody if they don't find it easy or accessible to access their actual community or to live in the environment of their choice. Now, there's lots and lots of debate about the definition of disability, but from what you can see here, Article 1 of the Convention states that it's long-term physical, mental, intellectual and sensory impairments. So it's not just physical. And I think this is the gap we need to fill. And that's where really the gap analysis needs to take place, is to understand the difference between giving physical access to somebody and actually giving somebody with a cognitive and sensory impairment equal access. I think what's key here is an awful lot of cognitive and sensory impairments are invisible. And because they're not visually perceived that somebody's having a difficulty, they may be actually having a difficulty in having a space, but because we can't visually see it, we don't take it on board and deal with it or design for their needs. Now, inclusive design, possible outcomes. There was a £50 million study done in the UK. It was done by the Department of Health, and it was really looking at people living with cognitive and sensory impairment, people living with dementia. But through the study and 115 pilots, they discovered that it was actually impossible to improve dignity and independence, reduce stress and anxiety, improve quality of life, and reduce social isolation. For the actual health system itself, they can reduce length of stay in hospital, reduce number of discharges to usual residents, reduce hospital admissions and readmissions, and improve medical outcomes and reduce the uptake of medication. And for society in general and for the carers, families, it could increase staff retention and reduce staff sicknesses and absentee levels, but reduce work-related stress and anxiety. Now, honestly, these outcomes are incredible. And if we had a drug that was doing this, it would be $1 million drug, as my husband would say, having worked in the industry, the drug industry. But actually, to think that we can improve people's lives to this extent and improve our social conscience within our communities to the point where we could give people these benefits, but we're not doing it, is astonishing. Now, it may have been a small study, but we know from experience, lived experience, that we can do this within communities in general and not just in hospital settings, but from our streets, towns, transport systems, theatres, public spaces, schools. All of these benefits can be gained by supporting people to live better and to understand their environment better. So I think one of the key things is a lot of people think that we just inhabit a space and that it's kind of a passive thing, but it's not actually. Our environment really does affect us on a day-to-day basis, and more than we possibly perceive it to be or know. So stressors in the environment are elements in the environment that cause confusion, maybe uncertainty, anxiety, stress, or fear. Now, all of us at some point in our lives have accessed an environment, whether it's an external space in a non-familiar town, or maybe we've entered a bar, or we've just turned a corner and we get this sixth sense that something's not quite right. And this is a case where our environment has stressors that we're not comfortable with. And as an able-bodied person, we will just leave that environment. We don't generally stick around to analyze what the problem is. We just get that sense that it's not right and we leave. So people do withdraw from places they find disabling, but also if they find it uncomfortable. And what we need to understand is that people with cognitive and sensory disabilities are much more in tune with their environments. They have to be, because they're spending so much of their energy, connecting with the environment and trying to interpret and understand it. So they will have this feeling on a much more regular basis than we do. And they don't always, in a lot of situations, have the ability to leave. So somebody that's admitted to a hospital won't have the option to leave, or somebody that's living in long-term care won't have the option to leave. So this stress, anxiety, and fear is there on a continuous basis because they can't escape that environment, unlike us if we're, enter a space that we don't like. So today we're building environments with stressors that can cause loss of function and extreme distress. Now that's quite upsetting thing to think, but actually it's true. And we witness it quite regularly in hospital and care settings. Maybe not so much, we might be as conscious of it in our, in our general environment or in our towns and cities. But there are people withdraw from these places because they find they just cannot manage. And that leads to loneliness and social isolation, which is another major issue in our societies today. So what can we achieve through inclusive design? So this is a graph that's trying to architects love diagrams. So what we're trying to do here is explain what we see we can achieve through inclusive design interventions. So here we have functionability and well-being. And along the bottom axis, we have years. Now, this could be days, months, years. It's just a diagrammatic representation. The green zone here is when somebody becomes dependent, and the white zone above is when somebody is living independently, maybe with a little bit of assistance, but they're getting about their day-to-day lives. Now, as people age or acquire maybe a brain injury or brain disease or maybe a sensory impairment, they will suffer functional decline. Now, here we've taken it, this represents a dementia, and it will be over time, the functional will reduce. And it may not, it'll go up and down, but diagrammatically, we're saying here over time, whether it's years, months, or days, their ability will decline. Now, what we're trying to do is if we design our environments to support somebody's functional reserve, we can push out the time they can live independently and extend the time before they enter the dependency stage. So one of the things you might be familiar with if you work in healthcare or social care is the concept of hospital-associated functional decline. And what happens here is we put somebody in an environment, they may be coping quite well at home, maybe living independently, but they go into an environment which is so, it's such a barrage of like cognitive, and sensory input and load on them. They find it very, very difficult to cope. And what will happen there is they'll crash. And this is known as hospital-associated functional decline. Now, what we're trying to do is, here we can see this can be quite dramatic. It can happen over a period of time. But what we're hoping to do is, through design, to extend the period here, which will enable somebody to live independently. Now, there's loads of benefits to this. Obviously, there's the benefit to the person themselves, there's the benefit to society as a whole, and obviously there's cost implication. As somebody becomes more dependent, it becomes more and more difficult and expensive to actually to aid and support them to live as good a life as possible. So what I would say to you is, when I started out on this quest for knowledge, the one thing I realized was I didn't really I knew that lots of the interventions worked, but I wasn't quite sure why. And it was only through spending time with people like Kirsty and all the great team at the GBHI that we managed to kind of decode how it works and the connection between the brain and the design interventions and why they work. So we could witness them working, but we weren't quite sure why. So we're going to have a look really at how the brain interacts with the environment and how they're connected. So what I would say to you is our brain is absolutely phenomenal. And I don't think we give it credit for half of what it does. And I would probably think 90% of the time we're not even aware or conscious of what it's doing on our behalves. And people will often say to you, you don't appreciate what you have until you lose it. But when you speak to somebody that's lost either a cognitive or sensory ability, and they talk about how they took so much for granted, if you think about all the things we do intuitively without even thinking about it that happen in the back of our brains, it's phenomenal. So if we take something really simple like catching a ball, so if you catch, somebody will say, well, what's involved? And I'll say, well, you reach and you grasp and you hold. But actually, there's so much more behind that's happening. Things like your spatial awareness. You might even hear particularly professional, they'll hear the ball hit the bat. They'll know from the sound of that how fast it's coming. You then have the spatial relationship, you have the velocity, the speed, the wind direction, your balance, your positioning. All of this is involved, but we don't even think about it. It just happens without us being aware of it happening in the foreground. What we're conscious of is stepping forward and grasping, but all of this has to happen for us to connect with the ball. If that doesn't happen correctly, so if our sensory, our cognitive perception is out, our ability isn't there, the likelihood is we're not going to catch the ball. And we take so much of this for granted. So understanding the brain and the interface with design. So if we think about the brain, every little bit of the brain does something different. So if you can imagine, this is the front of the brain, this is the back of the brain, and we look at the different things that we do to interact with the environment. So we have the temporal lobe at the front. So we have memory, spatial awareness, navigating a space, our sensory perception, so our hearing, our smell, and language. Now, you might think hearing and smell don't affect us, but they do. We have multiple senses, but we think we only engage with our environment through our eyes, but that's simply not true. And if you can imagine blindfolding yourself and trying to navigate around in a space, you will find that all of your other senses are actually working, but you're just not really as conscious about it happening until you're blindfolded. Then we have our occipital lobe, which is visual processing. And this isn't just about vision, but it's how we interpret the messages coming through from the eye. We then have spatial orientation, sensory processing, touch, pain, and object classification. Now, touch is really important. If you've ever seen any of these floorings that kind of mimic, it's one particular one I hate. It's a carpet, but it looks like timber boarding, and you stand on it and it suddenly gives, and you kind of go, you get that funny sense like it's not quite right. And yet we use this in care homes all the time. So people are confused and not processing their environment very easily. And we give them this confusing messages on top of what's already going on. Sorry. And then we have the frontal lobe. So we've got language, expression, movement, and balance, all really, really important. And reasoning, problem solving, judgment, and planning. All of these are involved in navigating our environments or inhabiting our environments, but we're not really conscious of that happening. But yes, if one of these small things are out of sync, we find it really, really difficult. So as a designer, we kind of work on the idea of procedural memory. So things that we've learned through our life cycle. If you've ever noticed a baby from the minute they're born, they touch, they smell, they taste, they stick everything in their mouth. But that's building this repertoire of knowledge that we have in our brains, and it helps us navigate our environment. And we build up these, what we call schema. So schema are when you have lots of things that you do in sequence, and you do them intuitively without thinking. So you're making a cup of tea. or you're washing your hands after going, using the washroom. So all of these things we do intuitively without thinking about it. And often you can do something like that and you haven't registered a memory of it. It just happens without you kind of register. It happens in the back of your mind rather than the forefront in your working memory. So it's kind of procedural. And really what we're trying to do is design our environment so they're as procedural as possible. So people don't have to use that forefront working memory to navigate and interpret the environment. And what that does is it frees up that working memory capacity to deal with the task in hand, or to interact with the people in the space, or to do your task. So what we're trying to do is make the environment as intuitive and easy to navigate as possible. Now, so what is that? Well, what you can see there is that to actually inhabit an environment, you have to use working memory. So that's what we call the cognitive load of an environment. So every building and every space, whether it's private, public, interior, exterior, will actually it will impose a cognitive load to inhabit it by the person. So your senses are being used, your cognitive ability is being used. So what we're trying to do is minimize cognitive load the building impact has on you, so that you have that free capacity to do other things. So cognitive load, or the inclusive design of interventions should fundamentally aim to limit the pressure on the working memory, and they allow individuals to operate on procedural memory as much as possible. Now, schema, as I've said, are all of those things you've been doing since childhood that are just intuitive. And I'd say things to you, you probably do these things without even thinking about it. If you wake up in the middle of the night, you can walk around your house without putting a light on because you intuitively know the number of steps to the bathroom or the number of threads on the stairs. You wake up in a hotel room that you're unfamiliar with, you suddenly get that moment where you go, oh my goodness, I'm not sure what's there. And you have to work really hard to interpret that space. And it's not going to be possible to walk around that space, say with the lights off, or just intuitively know where you are. So that's what we're talking about. Things that are procedural and known to you, that are really, deep ingrained in your memory, versus the things that you have to work on in the immediate here and now. So that will be the difference. So as many schema as we can possibly build in, make things intuitive for somebody, that's perfect. So what will take up working memory? So reduced sensory input. So if somebody has a sight deficit or hearing deficit or impairment, it takes an awful lot more working memory to figure things out. So you have to really focus on your vision if there's a vision impairment, or your hearing. So all of that takes up capacity that you wouldn't necessarily have to use if you were able-bodied or didn't have the particular impairment. So your senses can cause an issue. Anxiety and stress. So if you're in an unfamiliar environment or somewhere you don't feel safe, that can cause a problem. Again, unfamiliar, like the hotel room, that's going to take up capacity. Visual distractions, if there's an awful lot going on around you. So if you're trying to focus, I find this when I'm trying to focus and work, if there's lots of people around or there's lots of noise, I find it really difficult to sit down and focus or concentrate. And that's because there's distraction. And in a hospital or care setting, poor care can take up a lot of working memory, not necessarily to do with design, although it could be if the facility is not designed correctly, but it's just one of the things that can affect somebody. Fear is another one. Object recognition. We look at a sample of this later, but what we're really saying is, if things have always looked, I suppose if any of you are old enough to remember the good old phones where you had a handset connected to a wall with a dial. Well, somebody that has that as a memory of a phone, and suddenly you're handed this high-tech gadget. I call myself a technophobe because a mobile phone isn't intuitive for me. I mean, I can manage, but it's not great. Whereas you hand it to a 12-year-old, it's completely different. They just know how to do it because everything's, tech these days. Auditory distraction, again, just like visual distraction, it can be very off-putting. And decision making, if you give somebody lots and lots of decisions, if you're in a really, kind of a large building with lots of decision points, you have to decide to go left or right or straight ahead. All of these things are taking up working memory. So overload results in loss of confidence and independence and further decline of cognitive function. So what we're saying here really is that, the more pressure you put on the working memory, the more difficult it is, because it's using capacity in the remaining abilities. So what we have to do is reduce as much of the cognitive load as possible. So working memory and cognitive load. All I can say to you is if you can just imagine your brain being like a computer. And in the good old days, if you opened up too many windows, the computer would crash. It's exactly the same with somebody's brain. If you open up all of the windows and you've got all of this background, auditory distraction, noise, confusion, decisions, they're all windows that are open. And what's going to happen is the cognitive load will overwhelm and it'll finally crash. So working memory, just like a computer RAM, is limited in its capacity and duration. And that's the thing to remember. And the other thing to remember is everybody's abilities are not the same and everybody's capacity and duration is not the same. So we need to design to support, I suppose what you call the baseline. So we're not going to solve every issue through design, but there's an awful lot we can do to support people and eliminate an awful lot of what's causing issues. Now, fundamental requirements. Through 8 years or 10 years of research, the one thing I found, regardless of what the disability or impairment is, so whether it's ADHD, autism, dementia, sight impairment, there are 3 fundamental design principles that work for everybody. So if we start with these as a base, we can then build from there. Now, there are lots and lots of sets of design principles or universal design concepts or principles out there. But actually, if you boil them all back down, they come down to these 3 baseline requirements. So if we can get all of the institutions and organizations who represent all of these different disabilities or impairments or disease groups and say to them, if we can start with this as a base and get this written into legislation and guidance, we've really come a long, long way. So rather than everybody fighting their corner, individual corners, and saying, well, we need this, so we need that, let's just aim for these. We can get this legislated for, I think we're really doing well. So one is to reduce design complexity. And that's really saying, if there's a way of simplifying something and making it as obvious and intuitive as possible, great, let's go for that. We need to optimize sensory input. So what we need to do is not give too little sensory input, but not too much. And we'll talk about these further on. And then the third thing is access to nature. And I'm not going to really talk about that today because I think it's really, really well understood, the beneficial side of access to nature and its healing powers. And, there's been volumes and volumes written about it. And we all intuitively know that ourselves. Most times, if you're feeling really stressed and anxious, but you're out in the, somewhere natural environment, it brings down all your stress levels. So we've all probably witnessed or experienced that. So we don't need to go into it in too much detail. And what we do know is that people impaired may require these, but the unimpaired prefer them. I think we all prefer less complex, less noisy, vibrant environments. And we do all appreciate access to nature. So sensory impairment, what does that really entail? So brain disease and aging can reduce the ability to see, hear, touch, smell, and this affects a person's experience interacting with the environment. And we can see that from what we did earlier about how all of the different parts of the input that comes in. So if one sense is impaired, it affects our relationship. And people then have to rely on their remaining senses to navigate the environment. And there's one real misconception out there. You'll often hear people say, oh, well, somebody's lost their eyesight, but they've got a great, sense of smell, or their hearing is fantastic. You don't require superpowers when you lose one sense. You just have to learn and train your brain to reconnect in a different way so that you can use your remaining senses to navigate. It doesn't mean you have superpowers. It just means you have to work so much harder and the cognitive load is so much higher. So our goal should be to deliver relevant and necessary information without confusion or distraction. Now, what we're really saying there is, let's design environments so that all the things people need to see and need to understand are very, very clear. And there isn't lots of additional superfluous information out there that's distracting from it and causing overload. So really what we're saying is, let's bring it down, design so that we support people where they need the information, but we don't have too much going on to distract from that. And what I would say is, the eyes and the minds, if you've got lots of visual distraction, the eyes and the minds are unable to rest and have difficulty focusing on the relevant and filtering out the irrelevant. This actually is one ability that can be lost, and particularly with dementia, people will find that whereas we can sit and there might be somebody, I'm tapping in the background here, you can filter that out because you know it's not relevant, but people can lose that ability. So actually being able to just, to focus on what's relevant and lose the irrelevant in the background can become very, very difficult. Visual and auditory clutter can cause a sense of chaos, stress, and anxiety, and it can lead to withdrawal or a response if too challenging. Now, here's a picture of a standard classroom. Now, we know that an awful lot, there's been an increase in the number of children attending school with autism and ADHD and learning difficulties. And yet we can put them in an environment like this and expect them to focus on the relevant, what's relevant. I would think that an awful lot of able-bodied children would find this incredibly challenging. I would find this an challenging environment to work in. But we're not conscious of what we're doing. So even if we design the spaces, we have to make sure that we manage them and occupy them in the correct manner. And I'm not saying that there shouldn't be anything on the walls in classrooms. What I'm saying is we have to be conscious of where we place it so that it's not adversely affecting some of the students. Again, even in an environment we may not be conscious, we can automatically understand that what we see is a reflection. We can eliminate glare, but actually some of that ability can be lost. And for somebody that's really, really challenged, living in a space or finding the environment overwhelming, all of these things can add to the confusion. And again, just to understand that one person's limit is completely different to what your limit might be. So we can't just judge by ourselves. I am very, very sensitive to sound. I live in a household with 3 individuals who love noise. So they always have something going on in the background. They're as noisy as you can be. If I need to focus, I need quiet. And that's just my thing. But everybody's different. So I'm just going to give you a really simple example. Now obviously this is the drop in the ocean, but it's just to demonstrate one of the things we can do in design to support somebody with cognitive and sensory impairment. So this is a room, a really standard room. It could be a cafe, it could be a waiting room, it could be a hotel, it could be somebody's living dining room. And here you can see that we've got white and white and white. There's quite a lot of glare. And actually the only thing that's really pronounced in this environment is the furniture stands out. Now, if we introduce color here, and this is where we're using a design intervention, we're using color, which is creating contrast. This space kind of pops. So we've lost some of the glare. We can see the boundary between the walls, the floors, and the corner. And the skirting and architrave gives a very clear indication of the boundary between the floor and the wall. We can see here too that there's actually a step in this corner, which you probably didn't see in this one because it's very hard to read. And for somebody that's finding their environment challenging, they could be in this space and be completely lost because they may not perceive the volume or the space they're occupying. And that's really disconcerting for somebody. Also, they would find it very difficult to identify the door, but yet here you can see the door is clearly identified. And people will often say, particularly with a visual impairment, if you speak to somebody, they'll say they use the architrave and skirting because this is kind of our vernacular architecture. They'll use it to read the outline of the room and to identify the door, where the door is going to be, because it'll go up. But here we've added additional information here by contrasting the door with the wall. So here somebody knows the volume they're in. They can also read and see the furniture, but they can also see the exit and entrance. And one we would say is disabling due to lack of contrast, and the other is enabling due to the addition and understanding of contrast. And this will reduce anxiety and support confidence. So somebody in this space will feel much more relaxed and confident than in this space. And visual contrast between elements in our environment is key to legibility. Contrast, if used correctly, can support inclusion and access. It's the whole concept of camouflage. If everything's the same color and you can't see one thing from the other, versus where you contrast something and it's very, very pronounced and obvious. So now, cognitive impairment. So we talked about this earlier, but memory, reasoning, judgment, planning, decision-making, focus, and ability to filter can all be affected. And that's a huge list of abilities that we all take for granted. But just imagine even losing one of those and the effect it might have on your day-to-day interaction. So we should design environments to be intuitive, predictable, legible, and familiar. And when I say familiar, I don't mean, and there's a lot of this in the industry, particularly in the care industry, where people think But if you've got somebody who is in their 30s in the 1960s, will do retro everything. That is not what familiar means, right? And the other thing to remember is what designers will now pick out as being retro today were probably what the pop stars and film stars and multimillionaires had in their homes in the 1960s. It wasn't the norm for the average person living in society, right? So we've got to be very, very careful about using these buzzwords and not understanding what they actually mean. So intuitive, predictable, legible, and familiar. So we should also provide cues and prompts and signage to support working memory. So we can support people, we can take some of the cognitive load out by giving cues and prompts. And this also helps with wayfinding and orientation. So I don't know if anybody has seen one of these, but this is the new design of taps we're seeing in all the airports. I think they're designed by Dyson. So basically this tap gives out soap, water, and it also is the hand dryer. And it's so intuitive, they've had to put this big sign on the wall behind it to tell people how to use it. So there's nothing intuitive or familiar about this. What somebody's actually looking for is a set of taps, a towel, and soap. Now, I know that this sounds, in a sense, like I'm being really pedantic here, but actually it's really, really important. So I had neighbors and they were in their mid 70s, and one of the lady in the relationship developed Alzheimer's disease. And she was living for quite some time and eventually went into care. And her husband literally went every day to be with her. He spent the whole day with her. And over time, obviously, her disease progressed and things got more and more challenging and more difficult. And one day I met him and he was really feeling down. I said to him, "What's wrong?" And he said, "Well," he said, "Wendy is gone." And I got an awful shock because I thought Wendy had passed. But actually, what he was saying was that the woman he'd married was no longer there. And the reason he was saying it was all of the things she used to do, she was no longer doing. And it was the simple things that upset him. He said to me, he said, one of the things he said that upsets me most is she uses the bathroom and she doesn't wash her hands. And you're kind of going, well, in the overall scheme of things, is that important? Yes, it is very, very important. It's important to the person, it's important to their family, and it's important to dignity and independence. So I said to him, well, he said, she's in a beautiful care home. She's state of the art wash, ensuite, but she doesn't wash her hands. And he was really, really concerned. And I said, right, explain to me, give me a kind of a talk through of what's there. And he said, it's beautiful, it's clean, it's shiny, like it's everything you could want, And I said to him, let me guess, there's white walls, yes. And there's white soap dispenser, yes. And there's white towel dispenser with white towels. And he said, yes. How did you know? And I said, because that's what we do everywhere. We associate white with clinical and clean and sparkle with cleanliness. And I said, what she's really looking for are cues and prompts. So what she's looking for are the taps, the sink, the towel, and soap. And all of the things like the color in the towel, the soap, the scent, the feel, the touch, everything, they're all cues and prompts. Now, we might think this is a very small thing, but actually it's major. So I said to him, go out and buy her favorite soap. And she happened to like Pear soap, which I don't know if it might be a UK brand, but it's got quite a strong scent and it's quite strong color. I said, put the soap on the sink and put it in a nice contrasting hand towel. So anyway, after a week or two, he said to me, I cannot believe it. He said, you were right. So because all the cues and prompts were there and it was intuitive, it was legible and it was familiar, Wendy was now washing her hands. So it's the simple things that make a difference. Now, I'm not saying that this as a science is simple. It's not, but it's the little details that make all the difference. And it's understanding where and when and what makes that difference. So it's honestly might not be a big thing to us, but that was a huge thing for Wendy and her husband. So commercial environment. So that's a simple one, and that's familiarity. So here's just an example of some of the things you'll witness out and about when you're out and about. This is actually a really, really popular cafe in Heathrow Terminal 5. I don't know how many hundreds of thousands of people go through this on a yearly basis or maybe on a monthly basis. But they put this flooring. Now, for you and I, we know that's a two-dimensional tile pattern. But actually, the number of people I see stumble when they're walking on this floor because they can't read and they can't interpret what's happening here. It's a really, really challenging environment for some people. I actually saw one lady taken out in an ambulance because she had vertigo. She had a problem with her vision, and she literally stumbled to the extent that she fell over and really injured herself. So it's things like this we have to be conscious of the decisions we're making. And actually, does it really add anything to the environment? I'm not so sure it does. I just think it adds visual clutter. This is another one. This is a hotel I stayed in. And I honestly thought that they had some problem with their electrics. So I eventually managed to get into my hotel room. So if you can imagine, the numbers were actually on the lights. So anybody who had a problem with glare couldn't read their number because they couldn't look straight at the light. When I managed to finally get into my hotel room, I phoned down to reception and said, I think there's a problem with the lighting on the second floor. And they said, oh no, that's our atmospheric lighting. But listen, it's actually nearly impossible to find the keyhole, find the door. Like it's just not thought through. And I think that's bad. This is another one. This is a new design that one of the major chains, hotel chains, are trialing because they think it will stop people running down corridors. Honestly, I don't think anybody, if they knew the impact this was going to have on somebody with a cognitive and sensory impairment, would ever consider putting this in a public space. But there you go. So we're going to wrap it up now and just say that designed to support a sense of control and understanding. So really what we're saying is our environment does have a major impact on us. It takes up some of our cognitive ability. So we need to reduce the cognitive load as much as possible. So anxiety and stress equals increased behavioral responses, including apathy and or depression, and accelerated functional and cognitive decline. So our environments can have a major impact on our day-to-day living. And what we really want to do is design for a sense of control and understanding, which equals calm. And I think we all understand the impact of stress and anxiety and fear, but actually we are designing environments which are causing people to live on a day-to-day basis with anxiety, stress, and fear. Thank you.
Thank
Oh,
you.
sorry, I'm going to go back just 1 minute, if
Yeah.
that's all right.
No,
Yeah,
go back.
yeah. Kirsty asked if I would share some of the barriers to adoption. And I'm going to run through these really quickly, but I think I've listed the key ones, and the key is lack of awareness for the need and scale of the problem. I think your average designer, and probably a lot of people living in society today who don't have first-hand experience, are just not aware of the need or the scale of the problem. The number of people that are living with cognitive and sensory impairment. A lack of understanding of the benefits of inclusive design. I don't think people understand just what can be achieved through design, which is a real shame, but there we go. It's one of those, it'll be a eureka moment for lots, but actually the other thing too, it's such a gift and it's there for the taking if we could only build awareness. Policy and legislation are not keeping pace with research. So there's 40 years of understanding, research and studies, and yet our policy is just not dealing with cognitive and sensory impairment. We're literally legislating for physical impairment. And there's a lack of clear, accessible and comprehensive guidance. When I started out on my searching for this knowledge, it really took an awful lot of work. It took 4 years of really digging and teasing out. So what we need to do is make this knowledge accessible to designers and people involved in commissioning buildings and the like. The design curriculum in design schools just does not include this. There are a few specialist schools around the world that do it, but it's a specialist kind of master's degree. And actually, since we inhabit all spaces should be designed to support people with cognitive and sensory impairment, and not just specialized environments where we say, oh, we might have somebody with autism or we might have somebody with dementia. That's just not good enough. These people live with us in our community, so every space should be designed to meet their needs. There's an awful lot of blockers and folklore out there, and I'm not really going to get into this, but if somebody says to you, oh, this is common knowledge, we all know this, and we're doing it, they're not. I'm a specialist in the field, and I know that even I find it difficult to get clients to engage and kind of take on this whole concept and do it. So I'm telling you now, I find it next to impossible to find buildings that are designed the way they should be to suit. And in our and what I would say to you is our environment fit for purpose? No, because 40 to 50% of the population live with either cognitive, physical, or sensory impairment, and we're just not designing for it. architects and designers too often are more about first impressions, and they don't really consider the lasting impression, which is what happens when somebody inhabits your building and feels uncomfortable. They won't remember that it has a beautiful facade, but they will remember how it made them feel. And we never ask people about occupancy satisfaction. How many times have you asked somebody in a hospital ward what they think of the environment? Probably never. And why? Because they're probably not going to be satisfied. So, okay, thank you.
Thanks, Fiona. That really was an incredible presentation. I've learned so much. I'm sure many people on the meeting as well. Excuse my voice. Um, I have, yeah, I'm really interesting. I think one of my, when you're showing the tips,
Yeah.
and yeah, some of these modern kind of let's make things better, you do wonder why they actually doing it. And the one that really upsets me is these new lifts or elevators. I don't know if it's happening in the UK as well, but you can't choose from a panel where you want to go. You need to choose outside, you need to go to the particular lift, and then once you're in, that's the floor you go to. You cannot change your mind. You would have to go back
Oh,
down. Yes. Anyway, I think we need to bring you to South Africa, not for that. Yes. I have one question before I actually open to the uh to everybody. Looking at the built environment and how to keep people healthy. I think this is relevant for so many of us. I can see how this would help me, it would help people that I work with. But what I was wondering, particularly within South Africa or Pan-African context, we have lots of indigenous knowledge as well, and something I'm quite passionate about. But how could we potentially look at indigenous knowledge with regard to the built environment or design? And is there an experience you have within Ireland, potentially in terms of examples?
well, I think what when we talked about familiar, intuitive, and legible, I think our vernacular architecture is very much that. So what
Ah,
somebody's
interesting.
familiar with. So this can go across all cultures, all
Yes.
contexts. What you're really doing is you're keying into what's key in that person's environment and what's familiar for them and what's intuitive and legible. So I think, Indigenous knowledge is, I mean, the Irish lived in stone cottages with thatched roofs. And obviously, that's many generations ago, but we've developed a vernacular architecture which is very familiar. And it's all to do with the scale and feel, the homely. So, what we're saying really is people feel comfortable in spaces they're familiar with. People are comfortable in spaces they can read. People are familiar in spaces where they feel that they're not being, what would you say, like institutional spaces don't work. So care homes that have this institutional feel, and you've got maybe 50 or 100 people in a day room. Now that might sound to some people that that is not acceptable, but that's what we're actually doing in society in Ireland today. So what we need to do is revert back to the vernacular and really give people a sense of belonging and ownership of the space, which they can't have if it's in an institutional scale or an unfamiliar environment.
So really, if I'm listening, it's about decoding the elements in design that people would help people to become familiar, like or rather that they are familiar with, and
Yes.
to
Yeah.
yeah,
Yeah.
yeah, very insightful. Really, I do think we need to get you, yeah, somehow, Fiona. I'm going to open the floor to questions. Please unmute yourself and go ahead and ask, or um, in the chat box. But I think, unmute yourself, ask questions. I have a ton more. And Samu, please go ahead.
So, hi, Rancho, and uh, uh, the team. My question would Ballings. I'm here and women for as well. My questions would go to: are we in a position to have DDS be in a position to share with us the common practice? I understand Madam Fiona, she has wrote a book, but how would you make this information more available?
Thanks, Collins. Fiona?
The
Yeah,
very
thank you.
start, I didn't, it was very interrupted, but I think, Collins, what you're asking for is further input and further knowledge of how to design for people living with dementia.
Absolutely.
Yeah, it's actually very, very difficult. It's very dispersed, the information and the knowledge, and there's an awful lot of it which is misleading. What I would say to you is we're in the process of writing a document with the Department of Health and Social Care in Northern Ireland, which will be kind of an up-to-date guide. But what I would recommend you do is if you look at Richard Fleming and Kirsty Bennett, who are, I think it's a psychologist and a designer, an architect in Australia, and they have published some really, really good guidance, some good work. That will be a starting point. Um, I think there's definitely potential to do further workshops. I mean, I could talk all day, I could talk for a fortnight. But
Actually, Madam Fiona, to just mention, yeah, I've checked these guys on Australia to just re-emphasize, because I have been checking quite of your work. I saw the work that you are doing on Global Brain Health Institute. So
yes,
I think if we could have this sorts of workshop, I have worked with an architecture digital building interior, and also if we're in a position to have these workshops where the use of tech in the construction, in the building, and in the interior sector, where we are able to really much articulate, how should the balcony look like, how should this look like to accommodate, how should the kitchen look like, their areas of stay, how should they look like, so that we can be able to accommodate.
Thanks, Collins. You're breaking up a bit. I think we may have lost
yeah.
you also. But Fiona, I
Collins,
think there is an opportunity to do workshops in various settings, and perhaps it's something to start looking at funding for,
yeah.
particularly for, yeah.
I think there's huge potential because I think it's really it's a gap. I
Mm,
mean, we were writing this guidance for Northern Ireland, and what we realised was people talk about a lot of theory, but they never put it into practice. So what we're
mm,
trying to do in the guide is do a couple of interiors and say this is where your starting point is. This is how you would work step by step through it. But again, I mean, Collins, if he's involved in design, will know it goes from the micro to the macro, and back and forth. So from inception of a project right through, there's an awful lot of misconception that basically when you get to the final, fit out, that then all of this comes into play. But actually, no, from the very start, you have to build the building to get the best outcomes with this knowledge kind of, from the outset, so that the plan and the layout's right, the scope and the scale, there's a lot involved in it. But yes, I think, yes, it probably will take funding to build, it would take a group of workshops.
Hi. I want to follow up on that question of indigenous design. It's interesting that you raised the question because a few days ago I was asking colleagues of mine that are architects and to civil engineering whether there was somebody who was into what I found out on the internet is called vernacular design and vernacular architecture.
Yeah.
Big, and there are so many issues around this, in my view. One is the long-term impact on climate as people are moving as a form of transition from traditional housing and traditional infrastructure, which has worked for a long time, grass thatched and all of that, and the resource heavy modern infrastructure that everyone else is running towards. So I was quite interested in your workspaces, whether you're beginning to see interest in Africa around what you've just shared with us, and I get worried because I work in educational spaces. I get worried when I don't hear these in academic spaces, in training spaces. and the uptake of what you've just shared for us with us today?
I don't personally work in the African architectural space, so my experience would be in the Europe and UK and Ireland. So I do know that what we've discussed today is not generally on the standard curriculum within design schools. So I totally understand your point about going forward, you know, the climate and everything else. But actually, if I'm just to take the Irish scenario, my ancestors were living in stone built cottages with thatch roofs. And the death rate, I mean, people lived to a, you know, probably maximum to the 40s or 50s. So our architecture had to develop and it had to move on. And we had to, you know, we live in what I would probably call safer, healthier environments in the regard to, you know, kind of life expectancy. The effect it's having on the planet is a completely different thing altogether. But what we're talking about today is something that needs to be part and parcel of every architect's toolkit. So we need people, regardless of whether it's a green building, environmentally friendly, low energy, whatever it is, that doesn't affect what we're talking about today.
Yeah.
Everything we're talking about today can happen. It's about knowledge and expertise. It's not about cost. It's not about being, you know, environmentally friendly. It's about understanding how people interact with their environment and what makes it pleasant and accessible for them. And what takes out the cognitive load. So if we can reduce the load of the building on somebody, it opens up their capacity. And I suppose that's really the focus of today. I think the whole aspect of, you know, modern technology, how we're interacting with nature as such, and as, you know, as builders in the environment is really another topic. What I would say to you is, if we can embrace what we're talking about today, it needs to be on an equal footing. I mean, I often will have a brief sent to me and it's all about, you know, are we carbon neutral? Are we this, that, or the other, whatever? But actually, if the building doesn't work for the occupants, it doesn't really matter whether it's carbon neutral or not, because the people are suffering, you know, in that space. And actually, what we should be doing is enabling people to live comfortably. And we can do that whether it's eco-friendly, green, carbon neutral, whatever else. You know, it's a different issue, but it is an issue, and they all need to be addressed. You can't shelve one to succeed in another. Is probably my view on it.
I was wondering whether, because sometimes even if you're in Ireland, because I'm thinking in terms of brain health and all of that, whether there are any whispers that you're hearing from design schools in Africa, and because I'm not hearing it. So, and I think that's
No,
why I was quite concerned,
no,
because
I'm not hearing it.
yeah.
I'm not hearing it from Africa. I'm not hearing it from the general design industry. So, and the bits I am hearing, it's kind of saying, well, we need maybe our hospitals or we need maybe our care homes, you know, to facilitate, or our schools. I mean, there's a lot of talk in Ireland at the moment about we're going to build all these fantastic schools, new schools, and they're all going to have these sensory rooms. So we're going to build the entire building so it's not suitable for a child living with autism or ADHD. And then we're going to confine them to this safe space after we fail them in every other, you know, part of the environment. That's not the solution, and that's not what we should be doing. But I think in general, it's not been taken on board. There is a couple of Stirling University deals with it with regards to the older population. And there's a centre in London which are running a master's programme. But actually, every designer should have this. You know, they should have this knowledge and they should be aware.
And some I'll just come in. There are a few places. I know Rwanda, I spoke to somebody at Wits, somebody from Ethiopia, West Africa, names I forget, so apologies, but email me. But there are people who are looking at it in different ways. And in also to try and solve our specific issues. So the gentleman I met in Ethiopia, it was about how to construct the city to encourage social interaction, and how the current construct of the city is actually leading to increased isolation, which you mentioned in the start of your presentation as well. So there are people looking at it and looking at specific indigenous design philosophies, if you will. So even if it's not doing exactly what was done, but what do we learn from environment, local materials, local practices, and how are they still relevant? So yeah, just email me. And I'll send you some of those resources. Esme.
Good afternoon. It's Esme Smith from the Behavior Change Agency. Thank you. This has been very interesting. And yeah, I've just had a question around the process of engaging with stakeholders in the development of design. And is that part, or how do you engage with stakeholders so that they have an input into the design process, so that it does meet their needs and it can accommodate the particular challenges that they have, as well as the objectives of the environment. So as we spoke about the social environment, how do you create an environment that achieves that particular objective? So my question is around how do you then engage stakeholders? And then also, secondly, and maybe related to that, is then testing it, ensuring that it meets those needs. And there's a process of constant improvement and enhancement to meet needs as needs evolve. So thank you.
Thank you, Esme. Obviously, when we receive a commission, what generally happens is we will have an engagement process. And even when we're writing new documents or guidance, we will have a consultation process as well. It is really important that we get information. And as I said, this is an evolving science, so we don't have all the answers yet. And it's only as and when we build. I suppose what we need is some flagship projects. So we need to really, embrace this knowledge, take it on board, get funding. We need support from commissioners. We need stakeholder engagement. And it's only through trial and error we're going to evolve this science to the point where we can say, we're achieving our goals. At the moment, there are so few projects that are taking this on board. And there's so few, I think even with with clients, it's very, very difficult. If they're setting out, I mean, obviously funding is always an issue, but if they're setting out and they just want to meet the guidance standards, and you say to them, well, we want you to embrace this whole concept as well and build it into the scheme. Now, the initial concept, the initial reaction is, oh, well, it's going to cost us money. Actually, it's not going to cost you money, because whether you do it one color or the other, or whether you design it, with this layout or that layout, it's all about knowledge really at the inception stage. So I think, yes, it is absolutely imperative that we have stakeholder engagement, and we are. I think it is an evolving science and we don't have all the answers. What we do have is the baseline knowledge, and we need to build on that and develop a portfolio, I suppose, or a toolkit of how to do this correctly. And we will learn by trial and error. You'll often think, well, I've got this nailed. I think this is the way to go. And then somebody will go, well, actually, have you thought about this? And that's life. I mean, there's no perfect, there's no black and white. So I suppose what we have to do is start, and then it'll build a momentum. And with momentum is going to come, we'll actually have projects that we can analyze whether or not they work. And I did say before, we never ask for occupancy satisfaction ratings on buildings. It's something we never do. I mean, I don't know of any project where they've gone in after the event and said to people, a year after it's open, and said, how does this function or how does it work? But it's something we should be doing because it's important.
Thanks, Fiona. One question in the chat box was, any thoughts on Feng Shui? And then I'm going to hand over to Margot for the last question. So any thoughts on Feng Shui?
Well, I don't know an awful lot about it, but I think all of these things that are important to people, and if that's, if it's meaningful, it works, and that's the point, So yes, in certain cultures it's very important, and there's a whole science behind it. I understand. As I say, I'm not personally, au fait with all of it, but I think if it means something to somebody, it's really important that that's taken on board. But there's no reason why that can't work hand in hand in what we're suggesting today.
Perfect. Thanks, Fiona. Margot, that will be the last question.
Thank you, Kirti, for arranging this, and thank you, Fiona. This was amazingly informative. This resonates very much with ergonomics, and because the relationship is sort of hand in hand. And I think in South Africa, we had a law signed into the Gazette, I think about 2 years ago or just before COVID, stating or sort of enforcing ergonomics being applied in the workplace. Previously, it was only in the mining industry and sort of that kind of industry, but ergonomics goes beyond the workplace, and it goes into the homes, and it goes into a whole bunch of other areas, and it fits in hand so well with what you are talking about, because it's about safety, it's about comfortability, it's about reducing that stress. And maybe there's a link between the two that we could look at, and Kirti and I can have a discussion about that, because if we link the two, it could be driven from that point of view, in health, in policies, and a whole bunch of other, because it is so close. That's my thought. I don't know what you think about it.
I totally agree with you, Margot. I mean, the concept of having something that's beneficial to somebody in a workplace, and how you wouldn't implement the same understanding in every other aspect of the built environment just doesn't make sense. It's similar to what we're talking about here. This knowledge sits in social care and a little bit in hospitals. So when we have somebody who's living in care, when they find their community environment so overwhelming that they have to go into care and get support 24 hours a day, that we suddenly think, oh, well, we should do something special to assist them. Why not do that before they get to that crisis point, you know? And again, like ergonomics, if it works in the workplace, why wouldn't it work in all aspects of our lives and make it enhance our lives? So we shouldn't ignore these gifts. I mean, these are massive, massive benefit to society if we can implement all of this new knowledge. I mean, if you think about it, to the individual, the community, to families, to society in general, even to the exchequer. I mean, let's face it all generally in politics comes down to money. But if you think of the benefits and the gains and what we could do with this knowledge if it was just implemented, I mean, it's just such a missed opportunity. It really is.
Thank you, Fiona. So in closing, what can I do today in my environment to help my brain health?
Okay. Well, I have I used to love clutter. I used to have, I collected things, and we all do over our lifespan, we collect things.
Yeah.
And some of them have meaning, some of them don't. Some we just don't want to get rid of them. I would think major thing for most people is declutter your life. Honestly, I think, if we think about kind of this Zen spaces we always talk about, they're not full of clutter, So I think clutter is one thing. We should definitely ensure that we have access to the outdoors and nature. I think that's really important. So if in our home environment, particularly if we can make the outdoor accessible and comfortable, that's great because we spend more time outdoors. The benefits are just, off the scale. Also, if you're doing work or planning work, I mean, you're very, very young, Kirsty, so you don't really have to, to worry about old age. But if you're planning ahead, if you're doing major construction work or whatever, design your lifetime home. So make it, so that it can adapt, as Margaret said, so it adapts with you as you age. And if you're going to implement things, don't go for pattern and clutter on things that are permanent. So if you want to introduce interest into we're talking about interior design here, but rather than having pattern tiles or pattern carpet, introduce the pattern and what I would call little visual clutter on things that are removable, like cushions or throws, or so, and ensure that you have really good lighting, even well-lit spaces as you age are important. And it's not just for visual impairment, but the whole thing of safety in an environment. So yeah, I mean, but number one, declutter, both visual
You're
and
seeing my
auditory.
background with all my books, and you're saying declutter, Fiona.
Well, books aren't clutter. I mean,
Yes, no.
books in the right place aren't clutter.
Exactly.
But yeah. So and you're working with them to behind you, so it's different to having them like unless you have another bookshelf in front of you.
I'm not going to reveal that. Fiona, anything you want to say in closing, and then we will end the session.
Well, I would just like to say thank you to everybody who attended, and anybody who would like some follow-up, if you drop me an email, I'm quite happy to guide you into what documentation, excuse me, there is out there at the moment. And hopefully in time we will develop some more workshops, and there'll be some new guidance coming out. So I think one thing I would say is sometimes when you're looking for guidance, it may not necessarily be under the banner. So you might be looking for inclusive design under, say, autism or ADHD, but actually you might have to look in some guidance for, say, dementia. But ultimately, what works for one will work for the other.
Perfect. Thanks, Fiona. And thank you for an incredible session. Would you like to put your email in the chat, or
Can you
get hold
hold
of
on?
So thank you all for joining us today. It really was a really informative session. I learned so much today, Fiona. I am going to try and declutter. This is exceptionally hard. And I hope everyone gained something from this today. I think there's so much to actually learn on this topic, which is really not, it's neglected in a way, but I think so important. Um, yeah, and different levels, even if you don't consider dementia and healthy aging, even for us to live as a healthy society, there's so much room. So thank you very much.